There is a reason blood pressure can stay high even when a person cuts back on salt, walks more, drinks more water, and tries to eat better. It is not always because they are lazy. It is not always because they are ignoring advice. And it is not always because their body is permanently broken. Many times, the body is simply being told, over and over again, to stay ready for pressure. That sounds strange at first, because when people hear high blood pressure, they usually think about the obvious things: too much salt, too much weight, too little exercise, family history, getting older, maybe stress, but usually stress is treated like a side note, something emotional, something separate from the real medical problem. But blood pressure is not just a number sitting quietly inside your arteries. Blood pressure is a live signal. It changes from minute to minute. It rises when you stand up. It rises when you rush. It rises when you get startled. It rises when you argue, worry, sleep badly, drink too much caffeine, or spend the whole day mentally braced for the next problem. And that is where many people miss the real issue. The body has a built-in pressure system. It is designed to protect you. When danger appears, your brain tells your heart to pump faster, your blood vessels to tighten, and your muscles to prepare for action. This is useful if you need to run, react, lift, escape, or survive a sudden threat. The problem begins when that system never fully turns off. I am Dr. Warren Hung, a medical doctor, and this is one of those blood pressure topics that deserves a clearer explanation than people usually get. If you want calm, practical health explanations that actually make sense, subscribe to the channel, and let's talk about what may really be keeping that pressure higher than it should be. Because the one thing many people need to turn off is not just salt. It is not just caffeine. It is not just one food. It is the constant internal alert signal that keeps the body acting as if something is wrong, even when you are sitting still. Think of your blood vessels like small, flexible tubes. They are not hard pipes. They can widen. They can narrow. When they widen, blood moves through with less resistance. When they narrow, the heart has to push harder to move blood through the same space. That harder push is part of what raises blood pressure. Now ask yourself something simple. What tells those vessels to tighten? One major answer is the nervous system. Your nervous system is not just about thoughts, feelings, and reflexes. It helps control heart rate, blood vessel tone, breathing, digestion, sweating, sleep quality, and the way your body reacts to daily pressure. One side of this system is often described as the alert side. It prepares the body for action. The other side helps the body settle, digest, repair, and recover. The alert side is not bad. You need it. Without it, you could not respond quickly to danger or effort. But if that alert side stays switched on all day, your blood pressure may never get enough time to come down. This is where many people get confused. They say, "But I do not feel stressed." That may be true. You can have an overactive pressure response without feeling emotionally overwhelmed. You may not be crying. You may not be panicking. You may not even feel anxious. But your body can still be running in a low-level alert mode. A rushed morning can do it. Checking your phone before your feet touch the floor can do it. Poor sleep can do it. A late caffeine habit can do it. Constant noise, deadlines, financial worry, family pressure, long commutes, skipped meals, pain, dehydration, and even doom scrolling at night can all keep the body slightly activated. Each one may seem small, but the body does not always respond to these things as separate events. It can stack them. One signal tightens the vessels a little. Another keeps the heart rate slightly higher. Another raises stress hormones. Another ruins deep sleep. Another prevents the normal nighttime dip in blood pressure. Over time, the body learns a new baseline. What should have been temporary becomes familiar. That is why someone can say, "I am doing everything right," but still see numbers that worry them. They may be eating better during meals, but their nervous system is still running like a car with the engine revving at a red light. They may walk every day, but never give their body a real recovery window. They may take medication correctly, but still live in a pattern that keeps sending the body pressure signals from morning until bedtime. This does not mean medication is unnecessary. For many people, blood pressure medicine can be very important and even life-saving. No one should stop or change prescribed medication without speaking with a qualified healthcare professional. But it does mean that the number on the blood pressure monitor is not only a plumbing problem, it is also a signaling problem. Your arteries listen to your brain. Your heart listens to your nervous system. Your kidneys listen to hormonal signals. Your sleep affects your pressure. Your breathing affects your pressure. Your daily rhythm affects your pressure. So when blood pressure stays high, the question is not only, what did I eat? A better question is, what is my body being told all day? Is it being told, you are safe, you can recover, you can release pressure? Or is it being told, stay ready, stay tense, keep pushing. This hidden pressure state matters because the body was not designed to live there all the time. A temporary rise in blood pressure is normal. If you climb stairs, lift something heavy, get surprised, or exercise, pressure rises for a reason. Then, when the moment passes, it should come back down. The danger is not one short rise. The danger is when the body forgets how to return to calm. For many people, this becomes visible in small ways before it becomes obvious in a clinic. Blood pressure may be higher in the morning. It may spike after poor sleep. It may rise during work days but improve on quiet days. It may look better after a slow walk than after a hard workout. It may climb after a second or third coffee. It may stay elevated at night when it should be dipping. Those patterns are clues. They suggest the body is not only reacting to salt or age, it may be reacting to a constant demand signal. And that is important because a signal can sometimes be changed. Not instantly, not magically, not with one breathing trick done once, but changed through repeated daily cues that tell the body it no longer has to stay on guard every minute. This is why the phrase, "turn off this one thing," matters. It does not mean turning off your mind. It does not mean avoiding every responsibility. It does not mean pretending life is calm when it is not. It means learning how to stop feeding the body the same pressure message all day long. That begins by understanding what that message is. Because before you can lower a pressure pattern, you have to recognize what keeps switching it back on. The next step is to name that hidden signal clearly, so you can see why it affects the heart, the blood vessels, the kidneys, and even the way your blood pressure behaves while you sleep. The one thing many people need to turn off is constant fight or flight signaling. That may sound dramatic, but the body does not need a dramatic emergency to activate it. It can happen quietly. It can happen while you are working at a desk, sitting in traffic, checking messages, worrying about bills, sleeping poorly, or rushing through a normal morning before the day has even started. Fight or flight is the body's alert system. It is the mode your body uses when it believes you may need to react quickly. Your brain sends signals through the nervous system. Your heart beats faster. Your blood vessels tighten. Your breathing becomes shallower. Your muscles receive more blood. Stress hormones rise. Digestion slows down. Sleep becomes lighter. The body is trying to protect you. That is useful for a short moment. It becomes a problem when the short moment becomes your normal setting. Many people imagine stress as a feeling. They think, "I am not stressed, so this cannot apply to me." But your blood vessels do not only respond to what you consciously feel, they respond to what your body detects. A night of poor sleep can activate the alert system. Too much caffeine too late in the day can activate it. Scrolling through upsetting information before bed can activate it. Eating quickly, breathing shallowly, sitting for hours, dealing with constant notifications, or moving through the day without real pauses can all keep the system active. This does not always feel like panic. Sometimes it feels like being productive. Sometimes it feels like being responsible. Sometimes it feels like normal life. But inside the body, the message can be the same: stay ready. When that message stays on, the blood vessels remain slightly narrowed. The heart may pump with more force. The kidneys may hold on to more salt and water because the body is acting as if pressure and volume are needed. Hormones such as adrenaline and cortisol may stay higher than they should be for that time of day. Put simply, the body is not relaxed enough to let pressure fall. This is why blood pressure can be so confusing. A person may sit down for a reading and think, "I am resting," but their body may not be resting. The chair is still. The arm is still. The room is quiet. Yet the nervous system may still be running from everything that happened before the reading. That rushed phone call. That poor night. That second coffee. That argument. That deadline. That habit of checking messages every few minutes. The monitor does not only capture the moment, it often captures the state your body has been living in. This is also why some people see different readings in different settings. At home, their numbers may be lower. At the clinic, they may jump. During a calm weekend, they may improve. After several nights of bad sleep, they rise again. After a stressful workday, they may look worse than they did in the morning. Those changes are not random. They show that blood pressure is responsive. Now, this is important. Responsive does not mean imaginary. High blood pressure is real. It can damage arteries, strain the heart, affect the kidneys, and increase the risk of serious problems over time. A pattern of high readings should be discussed with a healthcare professional, especially if the numbers are repeatedly elevated or very high. But responsive means your body is giving information. It may be showing that the pressure system is being pushed too often. One of the clearest ways this happens is through the sympathetic nervous system. That is the alert branch of the nervous system. When it becomes more active, the body prepares for action. blood vessels tighten, heart output increases. The body becomes more pressure-oriented. The opposite recovery branch helps slow the heart, support digestion, deepen rest, and allow the body to repair. You can think of these two branches as a gas pedal and a brake. The gas pedal helps you respond. The brake helps you recover. Many people are not flooring the gas pedal. That is not the problem. The problem is that they keep tapping it all day and almost never use the brake. A notification. A rushed meal. A tense conversation. A poor night of sleep. A loud environment. Another coffee. Another hour sitting without moving. Another mental loop about something that might go wrong. None of these has to be extreme. But together they keep the body alert enough that blood pressure does not get the same chance to settle. This is why relaxation alone does not always fix it. Someone may sit on the couch at night and still not recover, because the body is being stimulated by bright screens, late meals, caffeine, alcohol, mental stress, pain, or irregular sleep timing. The person appears to be resting, but the body is not receiving clear recovery signals. Rest is not only doing nothing. Rest is the body getting the message that it is safe to lower pressure. That message comes through breathing, sleep timing, light exposure, movement, food timing, hydration, emotional regulation, and quiet periods without constant stimulation. A simple example is breathing. When breathing is fast and shallow, the body often reads that as alertness. When breathing becomes slower and more controlled, especially with a longer exhale, the nervous system receives a different signal. It begins to shift toward recovery. This does not replace medical treatment, but it shows how closely blood pressure is connected to the body's internal control system. Another example is sleep. During healthy sleep, blood pressure should usually fall. This nighttime dip gives the arteries and heart a lower pressure window. If sleep is short, broken, or shallow, the body may not get that drop. Morning blood pressure can rise, and the person may start the day already in a higher pressure state. This is one reason people over 60, or anyone with existing heart, kidney, or metabolic problems, should take sleep quality seriously. It is not just about feeling rested. It is about whether the body gets enough time away from pressure. Caffeine can also be part of the picture. For some people, caffeine causes a temporary rise in blood pressure. For others, the bigger problem is timing. A late coffee may not feel strong anymore, but it can still reduce sleep depth. The person may not connect the next morning's blood pressure to yesterday afternoon's drink, but the body may connect it. The same is true for constant mental stimulation. A phone can keep the brain in alert mode. News, messages, arguments, work emails, and short bursts of digital stress can train the nervous system to expect interruption. The body becomes less comfortable with quiet. And when quiet feels uncomfortable, the pressure system often stays active. So the hidden problem is not stress in the simple emotional sense. It is uninterrupted activation. The body was built to rise and fall. Pressure should rise when needed and fall when possible. The trouble begins when life gives the body many reasons to rise and almost no clear reason to fall. That is the pattern many people never notice. They try to lower blood pressure by changing one food or taking one walk, but the rest of the day continues sending the same alert signal. Their morning starts rushed, their breathing stays shallow. Their meals are quick, their phone stays close, their work never fully ends, their sleep is light, their caffeine arrives late, their thoughts keep running at night. Then they wonder why the number does not change much. The body is not ignoring their effort. It is listening to the stronger repeated message. This is also why the solution has to be more than telling someone to calm down. That phrase rarely helps. It can even make people feel blamed. High blood pressure is not a character flaw. It is not weakness. It is not simply being too emotional. It is biology responding to repeated signals. The goal is to change the signal. For some people, that may mean better sleep routines. For others, less late-day caffeine. For others, slow breathing practice, walking after meals, reducing evening screen stimulation, treating sleep apnea, addressing pain, managing anxiety, or speaking with a clinician about medication and risk factors. There is no single lifestyle trick that fits every person. But there is a single principle: the body needs daily proof that it can come out of alert mode. If it never receives that proof, blood pressure can remain higher than expected, even when other habits improve. So, instead of asking only, "How do I force the number down?" ask a different question. What keeps telling my body to hold pressure up? That question changes everything, because it moves the focus from chasing readings to correcting patterns. And once you see the pattern, the next issue becomes clearer. Many people are doing healthy things, but they are doing them on top of a nervous system that never gets permission to recover. That is why the usual blood pressure advice can feel frustrating, incomplete, or slow to work. Many people with high blood pressure are trying harder than anyone realizes. They cut back on salty foods. They buy a home blood pressure monitor. They start walking. They drink more water. They read labels. They try to sleep earlier. Some take medication exactly as prescribed. Some avoid processed food most of the week. And still, the numbers may not move the way they hoped. That can feel discouraging. It can make a person wonder if nothing works, or if their body is simply against them. But often, the real problem is not that the effort is useless. The problem is that the body is receiving two different messages at the same time. One message says, lower the pressure. The other message says, stay ready. And when those messages compete, the body often listens to the stronger one. This is why common blood pressure advice can fail when it only focuses on the surface. Salt matters for many people. Weight can matter. Alcohol can matter. Movement matters. Medication can matter. These are not small things. But if the nervous system is still in a constant alert state, the body may continue tightening blood vessels, raising heart output, and holding onto fluid in ways that keep pressure higher. So the person may be doing the right things, but not addressing the signal that keeps undoing them. This is especially important because high blood pressure is usually treated like a number problem. The reading becomes the whole story. 140/90, 150/95, 160/100. The person sees the number, feels fear, and immediately wants the number lower. That reaction is understandable. But the number is the result. It is not the full explanation. Blood pressure rises because several systems are working together. The heart pumps, the arteries tighten or relax, the kidneys manage fluid and salt balance, hormones shift. The nervous system decides whether the body should be calm or alert. Sleep quality affects all of this. So does pain. So does breathing. So does emotional load. So does the timing of caffeine, meals, alcohol, and movement. When all of these systems are pushing in the wrong direction, one small change may not be enough. This is where many people make the first mistake. They treat high blood pressure like a single food problem. They think, I just need to eat less salt. For some people, reducing sodium can make a meaningful difference, especially if their diet contains a lot of packaged foods, restaurant meals, processed meats, canned soups, salty snacks, and sauces. But salt is not the only signal the body hears. A person can reduce salt and still sleep badly. They can eat fresh food and still spend 10 hours a day under pressure. They can avoid chips and still drink coffee late. They can cook at home and still live with constant mental tension. So, the body may get less sodium, but it still gets the message to stay alert. The second mistake is thinking exercise cancels out constant activation. Exercise is powerful. A regular walking routine can support blood pressure, circulation, insulin sensitivity, weight control, mood, and sleep. But exercise is not magic if the rest of the day keeps the body braced. Some people do intense workouts while sleeping 5 hours, drinking caffeine late, rushing meals, and never calming their breathing. In that case, exercise may help fitness, but the body may still lack recovery. For certain people, especially those who are older, deconditioned, or already dealing with high readings, pushing too hard without recovery can even make the body feel more threatened. That does not mean avoid exercise. It means match the exercise to the nervous system state. A slow walk after meals can sometimes be more useful for pressure regulation than a punishing workout done on a stressed, underslept body. Gentle movement tells the body, we are active, but safe. It improves circulation without necessarily adding another stress load. The third mistake is ignoring sleep because the person is focused only on daytime habits. Sleep is one of the most underestimated blood pressure tools. During good sleep, the body should enter a lower pressure state. Heart rate slows, blood vessels get a break. Stress chemistry should quiet down. The kidneys and hormones reset their rhythm. If sleep is broken, too short, or affected by sleep apnea, the body can miss that recovery window. Blood pressure may stay higher through the night and remain elevated in the morning. This is one reason morning readings can be so revealing. They may show how well the body recovered overnight. If someone snores loudly, wakes up gasping, feels exhausted after a full night in bed, or has resistant high blood pressure despite treatment, they should discuss sleep apnea screening with a healthcare professional. Sleep apnea can repeatedly drop oxygen during the night, and the body reacts by activating stress responses. That can keep pressure elevated even when the person has no idea it is happening. The fourth mistake is treating medication as permission to ignore the pressure pattern. Medication can be necessary. For many people, it reduces risk and protects the heart, brain, kidneys, and arteries. This is important. No one should stop medication because they heard a lifestyle explanation. That would be unsafe. But medication works best when the rest of the body is not constantly pushing against it. Imagine trying to cool a room while someone keeps opening the door to let heat in. The air conditioner may still help, it may be necessary, but the room cools better when you also close the door. Blood pressure medication may lower the pressure, but poor sleep, high stress activation, late caffeine, excess alcohol, pain, inactivity, and constant stimulation may keep raising the pressure. The goal is not to replace treatment with lifestyle. The goal is to stop making the body fight itself. A patient pattern I have seen many times looks like this. A person comes in frustrated because their readings are always higher than expected. They have changed their diet. They are trying. But when you ask about the day, the pattern becomes clear. They wake up already tired. They check their phone immediately. They drink coffee before eating. They rush to work. They sit for hours. They breathe from the upper chest all day. They come home drained, scroll at night, sleep poorly, and wake up with high readings again. That person does not need blame. They need to see the pattern. Because their body is not just reacting to breakfast or dinner, it is reacting to the whole rhythm of the day. This is why recovery windows matter. A recovery window is a period when the body receives enough calm signals to lower pressure naturally. It does not have to be complicated. It may be a slow 10-minute walk. It may be 5 minutes of controlled breathing. It may be eating without rushing. It may be sitting in morning light before checking messages. It may be turning off screens earlier. It may be giving the body a consistent sleep schedule. It may be treating pain, anxiety, or sleep apnea instead of pretending they are separate from blood pressure. The key is that the body needs repeated moments where the alert system is not being fed. Not one dramatic change. Repeated proof. That is how the nervous system learns. This is also why some people see improvement when they begin measuring blood pressure correctly. They sit quietly for 5 minutes. They support the arm. They keep both feet on the floor. They avoid talking. They do not measure right after coffee, exercise, rushing, or emotional stress. Suddenly the reading is different. That does not mean the old reading was fake. It means the body state changed. And that teaches a powerful lesson. Pressure responds to conditions. If the condition is alertness, the reading may rise. If the condition is recovery, the reading may fall. Now, real hypertension is not solved by one calm reading. Patterns matter, repeated high readings matter, medical guidance matters. But learning how sensitive blood pressure is to internal state can help people stop seeing the number as random or mysterious. It gives them a way to investigate. What happens after poor sleep? What happens after a quiet morning? What happens after caffeine? What happens after a walk? What happens after breathing slowly for a few minutes? What happens when the evening is calm instead of overstimulated? These questions help reveal the signal behind the number. And once that signal becomes visible, the solution becomes more practical. You are no longer just chasing a reading. You are building conditions where the body has less reason to keep pressure high. That is why the next step is not another vague reminder to relax. It is learning the specific daily switches that tell the heart, blood vessels, kidneys, and brain that the body can finally come out of alert mode. The goal is not to force your body into calm. The goal is to stop sending it signals that make high pressure feel necessary. That difference matters. Many people hear stress affects blood pressure and think the solution is to relax more. But that advice is too vague. It sounds simple, yet it does not tell you what to do at 7 a.m, after a poor night of sleep, before coffee, before work, while your phone is already pulling your attention in 5 directions. So, think of this differently. Your body needs daily pressure resets. A pressure reset is a small period where the heart, blood vessels, brain, and breathing system receive a clear message. There is no emergency right now. We do not need to tighten everything. We do not need to stay braced. We can let pressure come down. You are not trying to become a perfectly calm person. You are trying to build repeated moments where the alert system is not being fed. The first reset begins before the day gets loud. Many people raise their pressure before they even stand up. They wake, grab the phone, scan messages, check news, look at problems, and start the day in reaction mode. The body has just moved from sleep into waking, and instead of receiving a calm signal, it gets a mental alarm. Try protecting the first 10 minutes of the day. Sit up slowly. Let your eyes adjust to light. Take a few slower breaths. Drink water if you normally wake up dry. Stand, move gently, and give your body a few minutes before screens, messages, and caffeine. This is not a magic ritual. It is a signal. It tells the nervous system that waking up does not have to mean immediately bracing for threat. For someone with blood pressure issues, that early message can matter. The second reset is breathing. Breathing is one of the fastest ways to speak to the nervous system. because it sits at the border between automatic and voluntary control. You breathe without thinking, but you can also change your breathing on purpose. When breathing is fast, shallow, and high in the chest, the body often reads it as alertness. When breathing slows down, especially when the exhale becomes longer, the body receives a different message. A simple pattern is this: inhale gently through the nose for about 4 seconds, then exhale slowly for about 6 seconds. Do this for 3 to 5 minutes. Do not strain. Do not force the lungs full. Keep it quiet and smooth. The longer exhale is important because it encourages the recovery side of the nervous system to become more active. In plain language, it helps the body find the break. This does not replace medication. It does not cure hypertension. But practiced regularly, especially before checking blood pressure, before sleep, or during a stressful day, it may help reduce the constant alert signal that keeps pressure elevated. And if you try this, pay attention to how your body feels afterward, not just the number. Notice the shoulders, the jaw, the chest, the speed of your thoughts. Those are clues that the system is shifting. The third reset is walking, but not the punishing kind. For blood pressure, movement does not always need to feel intense to be useful. A slow or moderate walk can improve circulation, help blood vessels relax, support blood sugar control, and reduce nervous system tension. It also gives the body a rhythm: breathe, step, look around, settle. One of the most practical times is after meals. Even 10 to 15 minutes of gentle walking after eating can help the body handle glucose and circulation more smoothly. It also interrupts the pattern of sitting, eating quickly, and returning straight into mental stress. A hard workout can be useful for the right person, but do not overlook the quiet power of repeatable movement. If your body is already tense, underslept, and overstimulated, a gentle walk may give a better recovery signal than another intense session that leaves you wired. The fourth reset is caffeine timing. Caffeine is not automatically bad. Many people can drink coffee and do fine, but for some people, caffeine can temporarily raise blood pressure, and for many others, the bigger issue is not the cup itself. It is when the cup happens. Caffeine later in the day can reduce sleep depth, even if you still fall asleep. That means the body may miss part of its nighttime pressure drop. The next morning, readings may be higher, and the person may need more caffeine because they feel tired. That becomes a cycle. Caffeine raises alertness. Poor sleep raises alertness. More alertness can raise pressure. So, experiment carefully. Consider keeping caffeine earlier in the day. Avoid using it as a substitute for sleep. If your readings are high, notice whether the numbers change on days when caffeine is lower, earlier, or skipped. People with heart rhythm problems, anxiety, very high readings, or medication concerns should ask a healthcare professional what is safe for them. The fifth reset is a true evening slowdown. Many people do not end the day. They simply collapse while still stimulated. The body is on the couch, but the brain is still in the fight. Bright screens, emotional content, work messages, heavy late meals, alcohol, and irregular sleep timing can all keep the nervous system activated at the exact time blood pressure should be preparing to dip. A better evening does not need to be perfect. Start with a boundary. Choose a point when the day begins to slow down. Dim the lights. Reduce phone stimulation. Avoid heavy problem solving late at night when possible. Give the body a repeatable signal that sleep is approaching. Sleep is not just rest for the mind, it is a blood pressure event. During healthy sleep, pressure should fall. The heart should get a lighter workload. The blood vessels should get a break. The nervous system should shift toward repair. If that nightly dip is repeatedly disturbed, daytime habits have to work much harder. This is why snoring, gasping, morning headaches, severe daytime sleepiness, or repeated high morning readings should not be ignored. Sleep apnea is common and often missed. It can keep blood pressure elevated because the body is repeatedly pulled into stress responses during the night. If those signs sound familiar, talk with a qualified healthcare professional about proper evaluation. The sixth reset is reducing constant stimulation. This one may be the hardest because it feels normal now. The phone is always close. Notifications are always waiting. The mind jumps from message to message, problem to problem, clip to clip, headline to headline. The body rarely gets silence. Even during rest, the nervous system is being fed little bursts of alertness. Try creating short no-input windows. 5 minutes with no phone. A meal without scrolling. A walk without audio. The first 10 minutes after waking without messages. The last 20 minutes before sleep without screens. These are not empty moments. They are recovery signals. At first, quiet may feel uncomfortable. That does not mean it is wrong. It may mean your nervous system has become used to stimulation. With repetition, quiet can begin to feel safe again. The seventh reset is measuring blood pressure in a way that does not accidentally create a false alarm. Sit quietly for 5 minutes before the reading. Keep both feet on the floor. Support the arm at heart level. Avoid talking. Avoid measuring right after exercise, caffeine, nicotine, rushing, emotional stress, or a heavy meal. Take readings at consistent times if your clinician has asked you to monitor at home. This matters because a bad technique can make the number look worse than it really is, and a frightening number can create more stress, which can raise the next number. That cycle is real. Measure with respect, not panic. Write the readings down, look for patterns, share them with your healthcare professional. A single reading matters less than the trend, unless it is dangerously high or comes with symptoms such as chest pain, severe headache, weakness, shortness of breath, confusion, or vision changes. Those situations need urgent medical attention. Now bring all of this back to the main idea. The one thing to turn off is the constant pressure signal. You turn it off by giving the body repeated proof that it does not need to stay in fight or flight all day. You protect the first minutes of the morning. You breathe with longer exhales. You walk in a way the body can repeat. You use caffeine carefully. You let the evening become quieter. You protect sleep. You reduce constant digital alarms. You measure blood pressure calmly and correctly. None of these steps requires perfection, and none should be used as an excuse to ignore medical care. High blood pressure deserves proper evaluation, especially if readings stay elevated, if you already have heart or kidney disease, if you have diabetes, or if you are taking medication. But these steps can change the environment your blood pressure lives in. That is the key. Your blood pressure does not live only in your arteries. It lives inside your sleep, your breathing, your daily rhythm, your stimulation, your recovery, your movement, your stress chemistry, and the signals your brain sends your body from morning until night. When those signals say, stay ready, pressure tends to stay higher. When those signals say, you can recover, the body gets a chance to release. So do not only ask, what can I remove from my diet? Ask, what can I remove from my body's alarm system? For many people, that question opens the door to a different kind of progress. Not instant, not guaranteed, but real, measurable, and deeply practical. If this helped you see blood pressure in a clearer way, subscribe to the channel for more calm, medical explanations that make health easier to understand. And if your readings have been difficult to control, do not guess alone. Bring your numbers, your sleep patterns, your medications, your caffeine habits, and your daily routine to a qualified healthcare professional. The number matters, but the pattern behind the number may be the part that finally helps everything make sense.